from the very beginning of my step retake studying, I took time every single day to do 4 cases a day. It took about an hour, so not that much time out of my personal residency, but oh my God, once I started doing the CCS cases, it became second nature. And I noticed I was even doing better at UWorld when I was doing the cases because I was learning how to think in that way, to think about specific names of medications, specific names of labs, order of when to order one thing versus another thing, highest likelihood of a diagnosis. Next step, that's a big thing that you do in these CCS cases and on UWorld, they're more likely to say, okay, it's this diagnosis, but what's the next step? What are you going to order on discharge? What tests are you going to confirm your diagnosis? Things like that. Another big thing that I did halfway through my CCS cases is I started to create a spreadsheet on my notes app, putting down every single diagnosis and case, what were the most important labs that I ordered that maybe I forgot or just were not intuitive, because there are definitely some, no matter for every single case, you always order common things like easy points, but the ones that aren't, or there's like nonce part of it. For a CT, sometimes you do with contrast versus without contrast. So I created that worksheet of the labs to order, what medication to order, if they had to keep them in the clinic, in the ED, discharge from the ED, or go inpatient, because that also was something I struggled with. For example, kidney stones. I thought originally that you had to put the person in the hospital, but if they're smaller than 10 millimeters, so 1 centimeter, they can just pee them out at home. So you just give them like pain medicine fluid and send them home. Every single time I did one of those cases, I would add them in, and they got really long because there's 179 cases. But then I would review them each night. I also, by practicing the strategy of you read the patient, do a physical exam, and then you don't always do every single physical exam. Sometimes you only do like when it's something that looks like it's going to be severe, the most critical, like lungs and heart, for example. And then labs, it's very important to not order the medication before you do the labs. They ding you on that. So labs, order the meds, and then keep going, and then maybe move them